Yeah. What is gynecological minimal invasive surgery? It is used in various ways. On one hand, to explore the abdominal cavity and to explore as well the uterus itself. It is a technique which has come on very strongly over the last 30 years. So throughout my career, I could very much observe all the new developments and changes. And it was extremely interesting to apply these technologies to the patients. It basically means one uses natural weaknesses in the body to operate. And on the abdomen, it is the belly button. And instead of making an incision like for a cesarean section, the need is only for very small incisions, which are 5 millimeters, which become after surgery fairly quickly invisible. So the cosmetic result is very good, but not only the cosmetic result, the trauma is so much less that you will have only a short time in hospital, and that the overall recovery, return to work, return to normal activities will be not very long. Obviously, it varies how extensive the surgery itself is. There are medical conditions which require invasive minimal invasive surgery are beginning from pain, so where we only have a symptom, to a feelable mass where the patient can feel that she has a swelling of the uterus. So it's a very broad range from just a symptom, discomfort, to make an inquiry, basically to get a diagnosis, to understand what is happening in the tummy. This is very important. And then to treat a whole range of conditions, which are from a cyst to possibly an ectopic pregnancy, to infection, to fibroids, endometriosis. These are the typical conditions which can be treated to different ranges, from just having a look, just removing small parts, to removing a large fibroid uterus and reducing with that the mass and the discomfort in the abdomen. When you come in for minimal invasive surgery, you usually need a general anesthetic. Yes, there is a small group of diagnostic procedures which don't require this, and one can help with a local anesthetic, but the vast majority, especially when there is a need or potential for some operating at the same time, it is much better to have a general anesthetic. A general anesthetic is a very safe form of pain control by sending you to sleep under the supervision of a specialist, and to make sure that you are pain-free. The anesthetics are usually well tolerated, and you wake up with little discomfort and have to sleep off the symptoms. Otherwise, the operations obviously very much depend on the need, how extensive they are. But the whole idea of it is, you come in the morning, you have your treatment, and you go home in the evening. Sometimes when the operation is taking place in the afternoon, then you might need to stay overnight. The recovery is ranging from days to around about 4 to 6 weeks, but that would apply then for a hysterectomy. If it's not a hysterectomy, you can look at 2 to 3 weeks as a reasonable average. So it's nothing to be scared about, and often I know it from women. They got symptoms on a monthly basis. So they then say, oh, it's only for 2-3 weeks. But if you multiply it by 12 times 3 weeks, well, then you lose more time due to your severe symptoms than other people got annual leave. With minimal invasive surgery, you got the benefit of having a very clear diagnosis, because one can look at the organs. One can test, for example, whether a fallopian tube is open and see the dye running through it. And if at the same time one can find some reasons, for example, for infertility, one can perform some adhesiolisis, free up a fallopian tube so that the function of the pelvis is normal again. And furthermore, one can treat pains as well. Often, when it's more around cysts, one needs to do these procedures for reassurance that there is nothing sinister causing the changes. All in all, the broad range can be achieved with a very small procedure, which doesn't cause you any long-term harm, because it is so minimal invasive that you can go home the same day, but you got all the information from the procedure. And often enough, I have been treated as well and got a benefit from that as well. Well, are there any risks? Yes, there is practically no intervention when one looks strictly at it, which doesn't involve any risks. However, one needs to put it into proportion and then see what benefit one has. So I always talk to my patients about the investment in time and risk and the benefits. So this obviously is a balance which one needs to analyze. And this is what one does in a conversation, to look at the issues. What is the investment to clarify it, and what are the benefits? And the benefits from intra-abdominal surgery obviously involve a whole raft of, from bowel injury, bladder injury, all sorts, but are possible, but they are very rare. And if you have surgery, for example, with very experienced surgeons, you reduce the risk for having problems later on an awful lot.